I think almost everyone listening can relate to this feeling.
Oh, definitely.
It's that sensitive, sometimes really painful moment when intimacy in a long-term relationship just shifts. It
Yeah.
goes from the spontaneous, joyful thing to, well, something that feels a lot more like a predictable routine.
And that is an immense source of shame for so many people and isolation. They feel deeply guilty, especially if the relationship is otherwise, really good.
I start asking these huge questions like, do I not desire my partner anymore? Is something broken in me?
Exactly.
That guilt is so powerful. So that's really what we want to do today. We want to dive deep into that guilt and replace it with some real knowledge.
Yeah.
We're going to look at two really distinct but super common scenarios that can derail desire.
Yeah.
First, the psychological burnout from predictability.
And then the very real physical and hormonal shift that happen, especially around midlife.
Our whole mission here is to normalize these experiences,
Mhm.
to show you that these feelings, they aren't a personal failing.
Not at all. They're a reflection of just how incredibly complex our sexuality is. I mean,
Yeah.
it's a holistic function, right? It reflects
Oh.
your emotions, your hormones, your stress, everything all at once.
Okay, so let's start with that first scenario, the psychological one. We're going to call her Emily.
Okay.
She's 32. She's 5 years into a really stable, very supportive relationship. They're great partners. They rarely fight.
Sounds pretty good.
It does. But Emily is feeling this deep sense of boredom,
Mm.
disconnection. And sometimes she even feels annoyed when her partner initiates anything,
And that brings us straight to the fundamental conflict at the heart of all of this.
which is what?
It's the conflict between stability and desire. Stability is amazing for life, right? It's how you build a family, pay your bills, feel safe.
Of course.
But desire, psychologically, desire craves the opposite. It thrives on novelty, on tension, contrast, that feeling of something unexpected.
That is the paradox, isn't it?
Hmm.
How do you keep the comfort that keeps your life running, but also introduce the risk that your erotic self needs?
Exactly. I mean, when you live with someone for years, your brain it transfers them from the category of potential lover to essential family member.
And the predictability takes over.
And if that intimate script is always the same, the brain just switches off. It stops paying attention. Why would it? It's seen the movie 100 times.
That's the autopilot effect we heard about. Emily actually described her intimate life almost like a ritual.
Mm-hmm.
A quick kiss, same time of night, same physical path neck, hips, straight to the bedroom.
Mm-hmm.
And then, the same 2 or 3 positions,
Mm-hmm.
all done in maybe 10 minutes.
Wow. Well, that level of predictability is the ultimate passion killer. She feels like she's just going through the motions.
Performing a duty.
Yes. And her body can't get excited because there's just no mental space for any anticipation or surprise. In fact, the body often shuts down arousal to protect itself from that monotony.
But this is where it gets really interesting. When her clinician asked what actually turns her on, she didn't talk about a specific act.
What did she say?
She talked about tension,
Yeah.
anticipation, the slow buildup outside of the bedroom, or the feeling of being intensely desired,
Yeah.
not just out of habit.
See, her desire isn't gone. It just needs a psychological trigger to break that routine.
It starts in the mind.
Precisely. Desire, especially for women, is often responsive. It needs a reason to start, not just a physical cue. And for that, you need psychological headroom.
Which brings us to the biggest thing, killing that headroom. Stress. Emily has this high-pressure marketing job, constant emails. Her mind is just always full.
And when the mind is overloaded like that, the body does triage. It shuts down anything non-essential for survival.
And erotic thinking is the first to go.
It's one of the first. You just can't be stressed about a deadline and truly present and aroused at the same time. It's almost impossible. Desire needs mental quiet.
So if your mind is blocked or the routine is just boring, sometimes people feel like they have to just signal the end of the ritual.
Mm-hmm.
And that leads us to a really difficult topic, faking an orgasm.
It's a pervasive issue. And the statistics they're really powerful. Studies show that a huge number of women, something like 60 to 70%, do not reach orgasm through penetration alone.
Good percent.
Yeah. They need clitoral stimulation or other kinds of arousal. But our culture has this narrative that demands this unrealistic instant pleasure.
And when reality doesn't match that expectation, performance anxiety just takes over.
Exactly. For Emily, she admitted she would fake it sometimes because she was too stressed to focus, or it just felt easier than trying to explain what she actually needed.
Right.
And we have to understand the psychology behind that. It's often motivated by a kind of kindness, not by deceit.
What do you mean by kindness?
Well, there's a deep-seated fear of hurting a partner's feelings, or pressure to seem normal, or honestly, just a desire to end it quickly because you're tired or uncomfortable. It's a protective act.
But it's a protective act that causes so much long-term damage, though.
Oh, absolutely. Think about it this way. When you fake pleasure, you're teaching your partner a false curriculum about your body.
Wow, a false curriculum. That's a powerful way to put it.
They think that what they're doing works, when in reality it's leading to your emotional withdrawal. And over time, that just builds this huge wall of resentment.
Okay, so we've covered the psychological traps, like with Emily.
Yeah.
Now let's talk about the physical side. What happens when it's not boredom, but an actual change in the body? We need to talk about Laura. She's 42, and her symptoms are very different.
And Laura's case is crucial because it so often flies under the radar. She's in a 15-year relationship, and her desire issues were linked to new physical symptoms.
Right, things like vaginal dryness, some pain or burning during intercourse.
Especially at the entrance, yeah.
And her libido was fluctuating, her periods were getting shorter, even some night sweats.
And that cluster of symptoms. It's just a classic early sign of the hormonal transition we call perimenopause.
Which can start in your early 40s.
Absolutely. The main driver here is the fluctuation and the eventual decline of estrogen.
So what does that drop in estrogen physically do to the body that impacts desire so directly?
Well, when estrogen dips, the vaginal and vulvar tissue, it loses elasticity, it gets thinner. It's a condition called genitourinary syndrome of menopause, or GSM.
So it becomes less lubricated, less pliable.
Exactly, and much more sensitive to friction. So intercourse can become genuinely painful, or at least really uncomfortable. That's where that burning sensation comes from.
So the discomfort just acts like a giant stop button in the brain. The body starts to associate sex with pain.
And the brain automatically shuts down desire as a protective measure. I mean, why would it want more of something that hurts?
It wouldn't.
And that leads us to a huge aha moment in treatment, because the solution here isn't just psychological.
Okay, let's spend a minute here because this is so important for anyone listening with these symptoms. Lubricants can help.
They can offer temporary relief for sure, but the long-term solution for restoring the health of that tissue is often topical or local estrogen therapy.
Now, this is a critical point that needs clarifying, because when people hear estrogen therapy, they immediately think of systemic hormone replacement therapy, or HRT.
Right, which is a whole-body treatment with a different risk profile.
So how is topical treatment different?
Topical estrogen, it comes in low-dose creams or vaginal tablets or rings, is a localized treatment. It's absorbed almost entirely by the vaginal tissue itself.
So it's not going through your whole system.
Very, very little of it does. It works right there to plump up and restore the health of those specific cells. It's a highly effective solution for that localized pain and dryness without the same risks as systemic hormones.
That is tremendously reassuring. It changes the conversation from, I guess this is just my life now, to, oh, there's a medical intervention for this specific physical barrier.
Absolutely. But even in Laura's case, a good doctor won't just stop at estrogen. They ran a full panel on her.
Looking at what else?
Estrogen and progesterone, yes, but also testosterone, which, yes, women have, and it's a major player in desire and energy. And also thyroid levels, iron, vitamin D. You have to check the entire ecosystem.
So whether the root cause is psychological burnout or a physical hormonal shift, the core solution for both Emily and Laura starts with one thing, that difficult, crucial step of opening up a really authentic, non-judgmental conversation.
Yes. The very first step is removing the guilt. You have to accept that desire is complex and it changes. Your intimacy needs to evolve, and that requires teamwork.
And the delivery is key. You can't start by assigning blame.
No. For routine and boredom, you avoid the word bored. Instead, you try something like, I want us to explore more together. I miss feeling excited with you.
So it becomes about a shared goal.
Exactly. Or for performance anxiety, you could say, I've realized I want to slow things down sometimes so I can truly enjoy being present with you.
And for physical changes, you frame it as a medical speed bump that you need to navigate together. It's not about them, it's about the symptom.
That framing is essential. But talking is just the start. How do you actually reverse that autopilot effect?
One of the primary techniques we saw was something called sensate focus exercises.
Yes, this is a powerful behavioral tool. It involves structured, non-sexual physical connection, cuddling, massage, slow touch.
But with one mandatory rule.
The goal is not penetration. It's not even orgasm. You explicitly remove the finish line.
How does removing the end goal actually help restart desire?
Because it forces the focus back onto sensation instead of performance. When the pressure to achieve an orgasm is gone, the body and mind can finally relax.
And you can feel again.
You can just feel you're relearning how to touch and be touched for pleasure alone, not as a means to an end.
It makes perfect sense. It replaces a stressful checklist with genuine presence, which brings us back to that mental space issue.
It always comes back to that. Desire needs room to grow. If you're chronically sleep-deprived or constantly checking work emails,
You can't expect your erotic brain to flourish.
you can't. You have to prioritize sleep, reduce stress, and this is a big one. Schedule intimacy when you're naturally energized, not at midnight when you're exhausted.
And the final piece of this puzzle is self-discovery.
That's right. The responsibility isn't just on the partner. The core message is, if you don't explore your own pleasure, you can't guide someone else.
And you can't expect them to be a mind reader.
Exactly. Your arousal patterns change over time. You have to reconnect with what feels good to you right now.
This entire deep dive, it really drives home that desire isn't some fixed, spontaneous flame you either have or you don't.
No, it's a complex, delicate muscle. It requires cultivation, attention.
And that cultivation, it actually leads to a lot of hope. You mentioned that many women in their 40s and 50s.
Yes, once they understand and treat their changing bodies, they often experience what some clinicians call a second wave of sexuality.
A second wave. I love that.
It's not about losing your sexual self. It's about embracing its evolution. It can become deeper, more knowing, more fulfilling than ever.
Which leaves us with this final thought for you, the listener. Intimacy requires moving from a mindset of fear and obligation to one of teamwork and shared joy. So if your intimate life currently feels defined by stress or avoidance, what one small habit, whether it's an honest word, 5 minutes of non-sexual touch, or just an extra hour of rest, what one small thing can you introduce this week to prioritize joy, not fear, in your connection? It's time to take that step toward evolution.